Making Big Shifts, presented by Marketing Reboot, with your host, Josh Anderson.
Hey everybody, welcome back to Making Big Shifts by Marketing Reboot. I'm your host, Josh Anderson, where we talk to real entrepreneurs making really big shifts and the real results that followed. Today, we're excited to have Dr. Badia here. He is the author of Healthcare from the Trenches, and we'll get more into that in a second. But welcome to the podcast, Dr. Badia.
Thank you. Thank you so much, Josh. Real pleasure to be here and share unique ideas.
Yeah, for sure. So you're calling in from Miami, right? So tell me a
Yes.
little bit about your practice, your specialties, and what do you got going on right now?
Sure. So I'm an orthopedic surgeon that's been in practice 30 years, limited my practice to hand and upper extremities. So that means hand, wrist, elbow, shoulder. Did my training at NYU. I'm a Cornell guy, undergrad, spent a decade at NYU, got interested in hand, went to Pittsburgh to do my fellowship, which was one of only 4 fellowships where it's the entire upper extremity. At that time, it was basically hand and wrist. So I kind of, one of my few skills is able to kind of project the future. And in fact, named my practice after I left the Miami Hand Center, which I co-founded. I named my practice Badia Hand to Shoulder Center. And ironically, somebody said, "Oh, you should trademark that." I said, "That's silly." And there's hand to shoulder centers all over, including 2 of the biggest ones, one in Indiana, one in Philadelphia. And but it really came from me. And I was solo until a year ago. Yeah. So I have a partner who focuses, he's not a hand guy, focuses on shoulder, elbow. And we created the Miami Shoulder Institute.
Okay.
So yeah, I've been in private practice 30 years, but I do privatemia. So I write a lot of peer-reviewed articles, clinical work, no basic science. I had no tie with a university, not a single university title. At this point, I'm proud of, actually. And and then I've written many book chapters, and I've lectured in about over 60 countries and all 7 continents. And yes, including Antarctica.
Lecturing, no, I have to get into that in a second.
Yeah.
All right.
So that's what I do. I love it. I've cut down a lot. I work a lot less. I mean, I'm not in the office today. I had to do a couple telemedicine, so I generally put on some kind of a physician outfit for that.
Yeah. Got it. For sure. That's interesting. Yeah. Tell us a little about this book too. And then I want to kind of dive into so much you said there, but we'll go down the rabbit hole later. But tell us about the Healthcare from the Trenches. Why did you write the book and who's it for?
Yeah, it's funny. I start out the book. I just did it's funny. It took me 6 years to get this, but our independent bookseller called Books and Books, really a tremendous a bookseller in Miami. I just did a reading, and so I read. I didn't read much of it, but I did read the first few sentences. It says, "I did not want to write this book." That was the first sentence. Because I explained that I'm busy doing more academic, but I felt that a physician in the trenches, right? So in the trenches, so this is, I am standing in a trench because when you hear about the problems with healthcare, you hear from very smart people,
right?
But they're not really treating patients, day in and day out. And we need to hear from more of us as to what the problems are with healthcare. So I wrote it out of, I don't know. I have a little bit of a entrepreneur mindset when I feel like I need to fix something, when I see something broken. I'm just not I'm not often very good at it in terms of the entrepreneurism part. But I do know, like many physicians, what the problems are with our healthcare system. And I wanted to convey that, not necessarily with a fix. So the last chapter talks about potential solutions, but that is not the goal of the book. The goal of the book is to first outline what the problems are, which you need to know before you can fix it, right?
Exactly right. Yeah. So the book is written for patients to understand the problems, right?
Yes, it's for the public. Obviously, clinicians, read it. In fact, ironically, it underscores what I say in chapter 4, that we don't collaborate enough. Just about the only negative reviews I've had about the book have been from physicians. Kind of interesting, right?
All right. Yeah. Well, it is very interesting. When you started the Miami Shoulder Institute, right? And you were talking to me before about this might be at that practice or one of your other practices. A large portion of your patients that you see are international, things of that nature. How are you marketing your orthopedic clinic, the Shoulder Institute, to the general populace? And what have you found to be an effective tactic to maybe increase those international patients?
Well, even when I was at the Miami Hand Center, which I co-founded in 95, and we quickly grew to 3, then 5 physicians. And some things changed. Like many groups, we splintered. And one of the reasons for me was that I wanted to give a little bit more boutique hands-on service. When you're on every insurance plan in network, they throw tons of patients at you. And, honestly, the insurance companies pay you so pathetically that to cover your overhead, you just have to see the volume. And that's okay, because it allowed me to become a much better physician, a much better surgeon, the volume I had. But I can only keep up that pace for so many years.
Yeah.
So it'll be 18 years now. I appealed off and started Badia Hand to Shoulder Center, which is the whole upper extremity. So Miami Shoulder Institute's recent. But even at Miami Hand Center, I realized many patients, because of our location in Miami,
Yeah.
many patients were coming to us who wanted an American opinion or even American care. In some countries in the Caribbean, there is no hand surgeon.
Mhm.
So right there, if they have the resources to be able to travel, they will do that. And Miami is the easiest stop. I mean, it's the most convenient, and obviously for all of Latin America. So we are a hub for basically every country. So yes, I've seen patients from Europe. I've had some from Australia. I've had many actually from India. But in this hemisphere, including Canadians, the snowbirds, because of their troubled healthcare system, which is very different from ours, right? So in fact, it's the exact opposite, but they have other problems, right? Access. So I just had somebody wrote me yesterday with something called Kienbach's disease at her wrist. She was saying she can't get in to see somebody for 6 months at all, and the condition will progress.
Yeah.
So she'll probably be flying down. She'll only need to be in Miami about 4 days, and I can evaluate. I can do first the telemedicine, which I've been doing about 5 years before the pandemic. I've been using Zoom, so well before COVID. And then that way I have all the imaging studies. I can examine them remotely. And that way they're jumping on a plane, not necessarily wasting their time, right?
Yeah.
Occasionally I see people, I go, you don't need me, you need this, or you don't need surgery at all. So let me recommend you to an excellent therapist in your home city. So, next month I'm going to Peru, to Lima. It's one of my biggest countries. I say top 3 or 4, but I've been going there for 25 years. I'm doing something academic, but I also will see some of my patients in follow-up, and they'll, usually bring an uncle or a coworker. So that's how I build it. I mean, it is a very gradual process, but I did it because I saw years ago that our reimbursements, which is a stupid word, by the way, we should be paid. We're paid. We don't get reimbursed.
Mhm.
Reimbursed, Josh, is when I loan you money and you give it back to me, right?
Exactly. Yeah. It's
Right?
something.
I mean, even that word, I cannot stand it.
Yeah.
So you can see I'm passionate about this. I realized that my jet ski mechanic was getting paid better to do a 30-40 minute procedure. And I said, I can't do this. So patients call the office and end up not seeing me because the public, I don't think, has figured out yet that the insurance companies really don't care about them. They really don't. They care about collecting their premiums and now controlling. Because before, it used to be, what I talk about in the book, the longest chapter is on insurance, not surprisingly.
It's not.
And I said, insurance company's job is to make money, and that's fine. I'm a capitalist. I was born in Cuba. I am a devout capitalist, and I have no problem with United Healthcare, Blue Cross, executives making a lot of money, but they are for profit. They shouldn't be answering to Wall Street.
Right.
They shouldn't be practicing money. They should collect premiums, make a lot of money, and pay out when it's appropriate, and not be deciding by authorization or pre-authorization what is relevant when somebody like me has 14 years of training. Like they should
totally.
So that is what's happening. So I realized that that patients from abroad, they're a different animal. They are focused on the medical problem. And, nobody loves to pay. I mean, I talk about this in an op-ed I wrote. People like to pay for luxury items, right? A Louis Vuitton bag. And you think about what that thing costs. I mean, is your wrist or your shoulder not as important as that? I don't know. So I marketed to this. And yes, some of the international insurance companies still, pay pretty well, 1% of your bill charges, and the relationship's good. I will tell you, a lot of them have started brokering us through domestic insurers. I'm thinking, this person from Mexico City is paying a lot for their insurance because they're usually boutique. And then they have to use the network of an American insurance company, which me and other physicians years ago said, we can't work with that. We can't pay our bills. So these are the ironies. And I think the public is starting to wake up, and actually people like yourself, having these podcasts is how we educate the public.
Yeah, no, that's very interesting. And I have a few clients within this space, right? Orthopedics, healthcare, things like that. And I was looking this up while you're talking because I was trying to remember the exact statistic, but this is Medicare back in 2022, 2022, excuse me, said they only
22.
reimburse 82 cents for every dollar they actually owe. Oh, yeah, and that,
Oh,
just
well,
think of all the
well,
other
but
insurance.
the other thing Josh probably doesn't know is that Medicare, CMS, the government, has cut our pay. Again, I almost said reimbursement. Um, on average, 2.5% every year for 20 years.
Hey, sorry to interrupt the podcast really quick. If you're getting value from making big shifts, please subscribe and tap the bell so you don't miss the next conversation. All right, appreciate it. And now back to the podcast.
Surgeons are being paid the same
Yeah.
as they were in the 90s, but we all know we've had inflation, consumer
Right.
price index, all of these things. So the problem is they're slowly killing private practice. So what happens is physicians now coming out of medical school, about 85% of them are employed, fully employed physicians. Compared to when I graduated in 89 from NYU, it was 6%. And they were mostly pathologists, hospital-based pathologists, some radiologists, et cetera, who were completely hospital-based. And that hurts patient care. Because I can tell you, I'm answering emails from patients at midnight, okay? Whereas, the hired physicians, understandably, are going to be like, it's 6 p.m., it's quitting
Yep.
time, somebody else
Time to
takes
go.
over. Do we want that kind of health care?
Yeah.
Do we want that? Yeah.
No, that makes sense for sure. Now, so that sounds like that's all great advice. So it sounds like a lot of your patients are just word of mouth, right? Are you being in the actual international country to attract more of those patients, right? Do you guys do anything, any marketing around Miami or things like that?
Well, we do more now because I have a partner who has to be in network, right? Because people don't know him. He's actually excellent. So Joel Peterson, he trained at, he's a Princeton guy, so I have to overlook that. But he did his training at Columbia, Columbia University, which is famous for shoulder, basically the first real shoulder surgeon, Charlie Neer, came from there. And then he did a fellowship in shoulder elbow at HSS. So these are very prestigious institutions, but people don't know him yet. So he is in network. So we do market, to answer your question, we market in the Miami area because until somebody knows who that physician is and they have a reputation, they may not, jump. I mean, I see a lot. I've had several patients from Alaska. So we do see a lot of domestic patients, but honestly, more of them fly in. In Miami, we are dominated, like many cities, are dominated by big healthcare systems, some very good hospitals. I'm not knocking them, but when I do a joint replacement for thumb arthritis, or I do a carpal tunnel release or a tennis elbow, not an invasive procedure, why do you need to go to a hospital? I mean, hospitals are for I was just reading about one of the new cardiothoracic surgeons that when the hospital's recruited. I mean, they have to be in a hospital.
Yeah.
But everything that Dr. Peterson and I do can be done outpatient. And I have been a big proponent. I'm actually on the board of a magazine called Surgery Business Magazine, and it's basically promoting ASCs, ambulatory surgery centers. And there are, I think there's over 6,000 of them now. And one of the big goals now is to get what we call parity. Parity means that if I scope your shoulder, the surgery center should be paid for all, what it takes for all that equipment, should be paid the same, or at least very close to what the hospital is getting paid. So that would lower our healthcare costs. Now, yes, that would mean hospitals would have to shrink. I'm sorry, but we are hopefully, there's a lot of health, a lot of longevity stuff out there. I mean, we think in the future that people hopefully will not have as much chronic disease and will need hospitals less. And so, but the point is that hospitals have to be expensive because they're running ICUs, or so we all have to share that cost.
Yeah.
But that drives our bill to 20% of our GDP, which is twice as expensive as number 2, which is either Norway or Switzerland, depending on what stats you look at.
Okay. Yeah. That's a whole different concept there. Whenever you guys, for like your was it Dr. Peterson? Is that correct? Yeah. So you're essentially like looking for an awareness play for him around the Miami market, just to get his name out there, get referrals, things like that. You guys really target primary provider referrals as well? Or?
Wow, we're trying to. I mean, I can tell you this is how difficult it's become with physicians, is that some primary care offices, the staff won't even let them pass. I mean, he goes there, he says, I'm here, I'd like to shake hands, I'm the new doc in town. And the offices have gotten so, healthcare's gotten so unfriendly because the staff is dealing with these, being put on hold with an insurance company just to get an approval for something that their physician is an expert in.
Yeah.
I mean, it's
And
crazy.
so what might get the line anyway.
Yeah. So what happens is when, they're so overworked in many cases, that now it's a matter of culture, right? I have a very open culture in my office. I have pre-med students who can shadow me. So at any given time, I have several people visiting with me because I believe that we have to share our ideas, whether it
Yeah.
be clinical, and I'm an open book with what I do clinically, or how we run our practice. And I learn from them as well. I mean, it's amazing how many changes I'll institute because somebody says, "Well, we do this in our office," or somebody who's not even a physician might say, "Well, this makes more sense." I go,
Yeah.
"Yeah, actually, it does, right?"
Right. Yeah. So why do you think the more collaboration is needed? Why do you think everybody is so guarded? Just because they're bombarded with requests so often, or what do you think the issue behind that is?
Yeah, I mean, obviously it's multifactorial, but amongst physicians specifically, I talk about this in my book, and I say that we started competing sophomore year college in organic chemistry. That tends to be the famous weed out course, right? So, and I have plenty of friends who took organic, and it's not they're obviously very smart. It's just I think the kind of memorization and what that particular course entails and the high grade you have to get in as to get into medical school, people go, you know what, maybe this isn't for me. But that competition that's been engendered during that course, I think
Yeah.
continues. We compete to get into medical school. We compete to get into resi. We compete to do a top fellowship. We compete for
Yeah.
a job, whether it be a practice or a hospital. And we have to stop competing. We are we have to play in the sandbox together, and
Yeah.
that
I
will
mean,
change things dramatically.
yeah.
I
Just sharing of
honestly believe
ideas
that.
for sure.
I
So
have
like,
these challenges in my own center. I mean, these are really good surgeons, but my God, I mean, sometimes to get them to answer an email or to agree on something, and I'm the one who has the most expertise, uh, because I've lectured at this Becker's meeting, which is a
yeah,
ambulatory
yeah,
surgery center. I write articles now, I think bi-monthly for that magazine I mentioned. I mean, I've written a book. There's not too many so to do that, you have to do research. So I'm pretty qualified, and yet, physicians will some of them by personality want to take charge,
Mm.
which is great, but you have to learn to collaborate and listen
right.
to people. So, for example, I get a contract from a lawyer. My God, I'm just my head spins. I'm just not good at it, and I'm
Yeah.
unfortunately not good at reading a P&L statement. So I know what I'm not good at, but
Yep.
I'm very open to learning and listening to people who know more than me.
Yeah, for sure. I think so. I think this might be like the 30th podcast we're on or something, somewhere around there. And I would say, whenever I ask for advice and you just kind of hit that when I say, what's the best advice to do? And people always say, find people that are really good at what you're not or where you want to go. And just
Yeah.
like ask them to mentor you or just ask them for advice. And I think that's huge. So,
Well, Elon Musk, right, said, I always wanted to fill a room with people smarter than me,
yeah.
which is probably pretty tough because that was the first Isaacson biography I read. And that was
Yeah.
about 15 months ago. And I've since read all 7 of Isaacson's because the people he writes about are so smart. And I figure if I can take something from them, whether it be Ben Franklin or Kissinger as a diplomat or
Yeah.
so the last one I finished was Leonardo da Vinci, who's, the
Oh,
ultimate
nice.
Renaissance man. Yeah.
Yeah. I'm actually
Yeah.
just kind of going there. I'm reading one, The Accidental President. It's about Harry Truman's first 4 months in office right now. Super good.
Oh,
Really
wow.
good.
Yeah, I would love that. I just finished 1929, which is about, I really didn't know a lot about the stock market crash
Yeah.
and learned that it was really a year and a half process. It wasn't really one day that we all
Yeah.
think. But yes,
Well,
and yeah, and so they talk about Herbert Hoover handing over the reins to FDR, but I don't know a lot about Truman. So I'm going to take that.
yeah. Put it on the
Yeah.
list. It's good. Yeah, for sure. I kind of got asked this question because you earlier said that one of your superpowers or natural abilities is kind of seeing not just the future. I think you kind of worded
Yeah.
it differently, but where do you see the future? This is a loaded question. I understand that, but where do you see the future of healthcare going in terms of? I know you already mentioned more ambulatory service centers. Essentially, what else are you seeing?
Yeah. Well, I definitely see migration to more outpatient imaging centers,
Yeah.
surgery centers, medication dispensing being in why do we have to wait in line at some, Walgreens or CVS's megapolis?
Yeah.
I mean, we already see Mark Cuban exposing the PBMs,
Yeah.
right?
Yeah.
Physician. I mean, people didn't even know what that stood for. I
Mhm.
didn't until I wrote my book. So I see that. But I do see, fortunately, maybe or fortunately, a kind of a two-tier system. I see it in European countries where colleagues work in the sort of the national healthcare system, and then at around 4 or 5 o'clock they go and open up private office where the patients who say, you know what, I don't want to, I have I think my healthcare is important. They don't have to be wealthy. It's just people have to prioritize their healthcare and say, I'm going to forego that vacation and get my shoulder arthroscopy with, one of the best people in Rome, Italy, for example. So I see that two-tier. I don't like to say that healthcare is all right, but obviously a civilized society has to provide healthcare for its citizens. There's, just like we need defense, right? There are certain things that government should be, but I don't like government controlling healthcare because I've worked in a VA hospital. They're terribly inefficient. We see about Medicare. Medicare started in 1965, was actually a very good payer. So physicians were very excited. I opted out 2 years ago and I hated to do that. So, but I'd rather go. I'm going to India to do surgery, for a week in July. I just did it in Bolivia recently. I'd rather provide the free care, honestly, to people who really need it than to let a payer, even if it's Medicare, have somebody, retired person, well-to-do. I mean, that'll be me in some years. And I pay for my healthcare. I just pay for it. Now not everyone can afford that. So we need to have a system that covers that. And I do think that I'm hoping to see insurance be more catastrophic. So I think we need to get them, and I think it is happening. We need to get them out of the way of delivering care because that drives up the price. We all talk about them denying care, right? And this, this unfortunate CEO was gunned down, but is bringing attention to this because, when people are denied, but denying is actually not the big problem because that's a small percentage. People have to fight to get it, but they eventually, in most cases, get the care they need. The problem is delay, and delay drives up cost and allows things that could be treated easier. In my case, perhaps non-operatively.
Yep.
When you delay it, then all of a sudden the cost is high. You need more staff just to try to fight to get that costs money. So every step of the way is made worse by a system that thinks putting somebody in, Fayetteville, Arkansas at a desk is going to screen and authorize a physician or clinician to deliver care. That I think is going to go away, Josh.
Yeah. Interesting. And when you say catastrophic, so essentially just that highest tier of only they'll pay for massive catastrophic injuries, and the smaller things people kind of self-pay for or something like that.
Yeah, like the dentist. I mean, a dentist, unfortunately, a lot of them are starting to take insurance. They hate it. They're not paid well for it. But most dentists really don't take that. So, when I go to the dentist, I put it on my, my credit card. I think we need to do that. So the catastrophic would be, you're hit by a bus. So you need me.
Yeah.
But you also pelvic surgeon, the femur or obviously malignancies, right? Cancers that are very severe that may need some inpatient care. But, we're moving towards the hospital as a home concept where, with technology, you can connect to the clinician and not have the cost of a big hospital. And what amazes me is still see some hospitals being built. It always baffles me. We did that in Miami. I'm thinking, but that's because it's a business model, right? And they want it close, but you don't need to be that close, right? I mean, even in Miami, even with bad traffic, you'll get somewhere, within a half hour. So all of these things will migrate because it has to be to more efficient and lower cost because we can't afford it anymore. 20% is crazy.
Yeah, amen to that. And as a side note, I used to live in the Keys for several years, and I remember that Miami traffic. The few times I had to drive through there, I hated it.
Well, it's funny you mentioned the Keys because I treat a lot, as you probably know, there really is no hand surgeon south
of Hollywood,
of Kendall.
Yeah.
South of Kendall. Yeah. So that is another example. Now, with telemedicine, when I see a patient, Key Largo's a little different, but if you're all the way down in Marathon or Key West, I just did one the other day. I do telemedicine for the follow-up. I mean, unless I need an x-ray and I really need to examine them, I can examine them like this. They'll get their x-ray locally if needed. Yeah. And I save them not 4 hours, but 8 hours because they have to drive back.
Yep. Even though it is a pretty drive, that's still a long drive.
It is a gorgeous drive. So yes, shout out to the Keys, one of the beautiful places in our wonderful country.
For sure. Before we wrap this up, what are you working on right now that you're excited about? Sounds like a lot of things, but what's going on?
Well, I'm reading a lot, Josh. So I'm working less clinically, for all the reasons I mentioned. I mean, people call my office, oh, he doesn't take my insurance. And, so that means to me that I have more time to read. I've done
Yeah.
enough surgeries in the last 30 years. So I'm doing a lot, for myself. I
Yeah.
have a second win with my book. So if there's a way for
Love it.
people, I'd love for you to read it, because I like when smart people read it and give me feedback, and hopefully give a little Amazon review, because that gives the book traction.
Amen. Yep.
So I'd love to find a publishing house, but I self-published during the pandemic. That was 6 years ago. So I'm trying to figure out how to get the message out there. I'm trying to
Yeah.
expand my international market, because it's just rewarding to me. People come, I've got, I had this fracture, it healed wrong. I enjoy that. So
But
I'm definitely working less. I mean,
yeah.
life is short. Another book I recommend is called Die with Zero. So that,
Okay.
yeah. And you can read that, by the way, in 2 nights. It
Love it.
basically says that, in Western society, US is famous for this. I mean, we kind of work on building wealth for retirement, but if you're pretty well, if you have good income, we end up oftentimes over saving.
Yeah.
And then if you want to, give to charity or give to your children after you're dead, that's not as rewarding as doing stuff when you're alive, right? So,
Yeah.
and there's actually formulas there about how much. So I realize that at this point in my life, I can work less. So I travel a lot. You already know most of it is related to academia, privatemia. But
Yeah.
sometimes I just go somewhere. I mean, I've been to 4 African safaris. My son's coming back tomorrow from Kenya. He's with a
Oh,
school
nice.
trip. Yeah. So
Yeah.
I was at that trip 2 years ago. Pretty similar itinerary.
Yeah.
So I do things like that, and I think that it's important for people to realize, life is not a dress rehearsal. I don't want to, I don't want to be doing surgery day in and day out until I'm in my mid-70s, even if I could.
Yeah.
I don't think that's smart.
Yeah. That I'm gonna check that book out, because I'm in this big phase 2 of reading. I go through spurts, right? But Things That Matter, that book back there, Joshua Becker, he was on. I
Yes.
interviewed him on a couple days ago, and that's kind of it probably goes hand in hand with that Die with Zero. It's about minimalism, right? It's about like you don't need all this stuff that Western, like the
Incredibly.
environment. Yeah, it's a great book too. So, any other books you want to recommend? Because I'm filling out my reading list right now.
Wow. Well, actually, this is a good time to mention this. I just started it this morning. It's called The Agent. So people have heard of the film Jerry Maguire.
Yeah.
Well, I didn't know Jerry Maguire was modeled after a guy named Lee Steinberg, who I just met 10 days ago. I was in San Francisco. I was invited to join this group of 100 physicians, mostly orthopedic surgeons, because he realized that physicians really often get screwed, to be very blunt. So he saw it in the 70s, that was happening to athletes. And now we went the other way. Thanks to him, I mean, the guys are getting these incredible salaries and packages. But he realized that the physicians who often take care of them and keep them on the field, like football. I mean, every football player pretty much has had an orthopedic procedure.
Yeah.
That we are getting, kind of screwed in society. So his annual Super Bowl party was amazing, and he, along with a very smart guy named Michael Sukes, who's an orthopedic trauma surgeon and a lawyer and a public health degree and an MBA.
Oh man.
Oh yeah, Michael's a bit overachiever. So Dr. Sukes and Lee Steinberg got together and created something called MD Envoy. So you may hear about it. MD Envoy is really the first agency that will represent physicians.
Wow. That's
And
interesting. That's exciting. Yeah.
yeah, so I want to know more about Lee Steinberg, and I'm reading about his childhood right now.
There we go.
And I'll finish this by the middle of next week. So
Perfect.
yeah.
Well, Dr. Badia, where people can find the book on Amazon, right?
Yeah, Amazon, and I think Barnes and Noble has it, but Amazon, it's easy. It's on Kindle as well for those who
Yeah.
like, I like to read the book, but that's me.
Yeah. Same here.
And then you can also get it on for people with long commutes or gym rats on their treadmill. You can find it on Google Audiobooks.
Nice. And then if people are interested in maybe, I don't know, bringing you in to speak, where can they find more information out about you?
The best way is my website, drbadia.com. So drbadia.com. And I actually answer myself right on homepage. It says, ask Dr. Badia. I learned a long time ago, I'm not that important. So I answer, maybe at some point I'll get overwhelmed with inquiries. I don't think so. So I answer. And if somebody wants to, invite me to be on a podcast just to speak somewhere, or That's how patients reach me.
Yeah.
You're from another place and you say, you know what, I have this shoulder problem and I really would like an opinion. At least I can set up a telemedicine appointment.
Right.
And you can do that on the homepage specifically. And I have a great team in Miami. We're right next to the airport. So we're very accessible.
Yeah.
Yeah. You know Miami. But yes, the traffic's hard. But I will tell you, one of the few places where you can just park and walk into my office or the surgery center.
Yeah, there we go.
You
Yeah.
just park. There's no ticket. There's no valet. I mean, it's just, we have 400.
Which is a rare. That's a rarity. Yeah. For Danes.
Which is rare. Yeah. Well, I bought the first floor of that building and built it out, including this 3-room surgery center. I did that in 2007. And then Doral has grown around it. In fact, there's an incredible mall called City Place Doral right next to us. And they don't have enough parking. So we're quite blessed with that.
Yeah, for sure.
Yeah.
Well, Dr. Badia, I really appreciate you taking the time. I know you're busy. So thank you for coming on the podcast. Appreciate your
Thank
time
you.
and wisdom.
My pleasure. And I look forward to hearing your comments on the book, because I can tell you're a big reader, and I think you'll gain some interesting insights from that.
Yeah. I'm going to check it out.
Thank
Well,
you.
guys, it's time to wrap it up. I do appreciate everybody for listening to Making Big Shifts by Marketing Reboot. Please like, subscribe, and share. And we'll catch you on the next one.
Wonderful.
Hey guys, thanks so much for listening to Making Big Shifts by Marketing Reboot. It would be a huge help to us if you subscribe to the channel and share this with somebody that you think needs it. Your support helps us continue to bring great guests on board and keep the conversation going. Have a great day.
Thank you for listening to Making Big Shifts. Like, share, and follow for more. Join us next time on Making Big Shifts, presented by Marketing Reboot,